And then we have the last speaker. So okay, first question.
I think he's already answered all these.
I know he's already answered. You have 90 seconds to answer each question. All right, the first question. Will you pledge to fully repeal Obamacare?
Yeah, it's unconstitutional. Absolutely. I pledge to repeal Obamacare. It's unconstitutional. It needs to go away.
Yes. Second question. We're in a war on terror. Who are we fighting?
Yeah, we're fighting radical Islam. And, you know, I look back and I worked in the Center for Operations Plans and Policy in the War on Terror at U.S. Special Operations Command, where they are the lead element globally. And it's ugly. I've gone into other countries, had to work with their military operations for counterterrorism training. Folks, it's not a country this time where they wear a uniform. It's a global war. We were operating in 120 nations. And we need to realize that these people are patient and they are not just going to go away. Yes, we eliminated Osama bin Laden, but the radical Islamic movement is not at an end, and we will have to continue to protect ourselves.
That's right.
We do need health care reform. What would be your plan?
Well, when we look at health care, you know, constitutionally, I guess they can try to hide it under that as part of the welfare of the country. But I think the first thing we need to do is we need to strategically align the healthcare system. I work in healthcare. I've worked with every medical school and teaching hospital in Florida. And we take a look at, number one, we need tort reform. And it's amazing to me how in this state we can't get that done. But it costs the doctors a lot of money for their insurance, costs the providers, so we got to get rid of tort reform. And we need to get where doctors and hospitals don't have to prescribe duplicative or unnecessary tests just to get paid or to avoid lawsuits. And we need to get rid of waste, fraud, and abuse. So I think the first thing we've got to do is create an environment that will help cut these costs and let private sector provide the services.
We all know the Paul Ryan plan does not affect anyone 55 years and older with regards to Medicare. Do you endorse the Paul Ryan plan, and why or why not?
Yeah, I know there's a lot being said about this, and, you know, only, you know, this person or this person or this person supports the Ryan plan. And it's like I said at Palm Beach REC a couple weeks ago and many other times, if we have to vote yes or no, I vote yes for the Ryan plan. If we have the luxury of time to tweak it a little, to make it maybe for me what might be more fair for someone 54 or 53, I would like to do that. But first, I support it. I would vote for it. If we have the opportunity to make it a little different, I would. In that, if you're 53 and you've been working since you're 21 and you've already been contributing for 30 years, I'd like to give you some consideration, maybe have a little bit of a sliding scale in there. But we got to do something. Until we have a better product, I would vote for the Ryan plan. I would just want to make sure all options are looked at and considered.
What do you think is the biggest problem with our economy?
Folks, this is a complex problem. I've chaired a lot of MBA thesis research on offshoring and outsourcing. I was the lead faculty in the Global MBA for Phoenix. We got to recognize the fact, yeah, our government spending is a problem. We got to fix that. But we're 5% of the world, and we're now competing against the other 95% of the world. Phony currency devaluation.